Today I am joined by the Territory Controller and our Chief Health Officer to advise you on an emerging Territory situation. I can advise that we have a positive case for coronavirus at the Granite mine in the Northern Territory. This is an isolated mine site located 300 kilometres from Largermanu and 250 kilometres from Yuendamu. I will provide you detail on what we know and what we are doing. The gentleman travelled to the Northern Territory from Bendigo, Victoria on the 17th of June via Queensland. In Queensland, he was directed to quarantine as they had directions in place for anyone travelling from Victoria. Based on the testing, we believe he caught coronavirus in that quarantine hotel in Brisbane. He then travelled to the Northern Territory to work on the mine site. We did not have directions in place on that day for anyone from Queensland or regional Victoria. On the 24th of June, he received a text message from New South Wales Health advising him that the hotel in Brisbane was a potential exposure site. He immediately isolated and tested. He received the message from New South Wales as his driver's licence is currently from that state. As soon as his test came back positive around midnight, approximately 12 hours ago, the Director for Centre for Disease Control was notified and our emergency procedures kicked in. Everyone on the mine site has gone into isolation and the mine started shutdown processes and contact tracing commenced. I and other members of the SEMC were notified about 8 a.m. this morning. Staff have been working on this since midnight. There have been a significant number of meetings and conversations with them, the mine and our fellow states. We consider the individual to be potentially infectious from the 18th of June to the 24th of June. We do not know the variant yet, so we are assuming it is the Delta variant, the worst case scenario. It is better to over-prepare than underestimate the risk. There are 754 people in isolation on the mine site. 900 people approximately have left the mine site over those days. They travelled to Brisbane, Perth, Alice and Darwin airports. All 900 have received messages to test and isolate. We have all home addresses from the mine. The mine has an exceptionally tight COVID management plan and processes in place. We are confident we know all the people who have moved in and out of the mine site. We are asking all 900 to identify where they are isolating. Where they have travelled to another jurisdiction, we will advise that jurisdiction. If it is in the Northern Territory, they must either isolate in a suitable location or at the Todd facility in Alice Springs or the Centre for National Resilience in Darwin if they don't have a suitable location. We have all the data from the mine. We are working through it now. We don't have it in a format where I can conveniently say to you right now how many of the 900 are in the Territory versus interstate. We will know that soon, but we have all the information. Of those 1,654, 70 are considered close contacts. They are all on the mine site and are being moved to the Centre for National Resilience at Alice Springs. We will be meeting again this afternoon to consider the information on where the 900 are, how many tests are required in the Territory and when the results will be known. We believe we have the testing capacity we need, but we have also stood up additional facilities in Victoria if they are required. We will continue to make decisions as more information comes in. This is not a case of community transmission. This person is isolated. We are moving him and all close contacts to the Centre for National Resilience at Alice Springs. While we've never had a case of community transmission in the Northern Territory, we have constantly prepared for this situation. We will do everything we can to test, trace and trap this virus. We will always do whatever it takes to keep you safe. You can help us. Remember, maintain your distance, wash your hands. If unwell, do not go out. If symptomatic, then isolate and get tested. Our best defence remains you. Territorians have been the best. That's how we have been the safest and how we will stay the safest. I will now pass to the Chief Health Officer, then the Territory Controller, to provide more information and context on what we have done, what we are doing and what we are prepared to do. Thank you.
Thank you, Chief. This is a lot to take in. The first thing, I'd like to thank all of the various teams that have worked through the night dealing with this issue. As the Chief Minister's described, we have planned for this, we've practiced it, anticipated, we have systems in place. The difficulty here, although we know the detail of the persons who are at the mine site and those who have left, and we'll be in touch with them, and you might appreciate that contact tracing isn't just a text message, it's actually a conversation about where you are, where you went, and these include people who live here, in particularly Darwin and Alice Springs, but also may have been transiting through here. They may have been to the market or other places while they were here, and other people may have transferred on the charter flight, and they may have on-travelled somewhere else. So I've engaged with all of my colleagues, the CHOs around the country and the Commonwealth CMO, to alert them to this, because this is significant in the sense of the time the person actually was infectious and then the time that people actually left the site and they may have been infected. That is yet to come. So we've got the testing capability, we've got the contact traceability, being it that you need to take a number of hours sometimes to find out where people actually went and who they mingled with. So the information that we will get over the coming hours and days, we will share with you. But I want to make very clear that we are at risk. And we have a lot of people in the Territory at the moment, and that's wonderful. A lot of people are out and about and going to the lovely events that we have at present. But I want to really get people to reflect on the principles that we've described before and the Chief Minister's just reiterated. And that is, if you have any symptoms, please arrange a test over the phone or on the website, and then isolate yourself. If you have any symptoms, please do not go out at all. Do not mix. If you are going out and about, and we've got some lovely events today around the Territory and in the coming days and week, if you do not feel comfortable mixing with people where you cannot maintain that physical distancing, and we now know that this, if it is one of the variants of concern with greater infectivity, then in fact you really need to be considering wearing a mask in a lot of situations, and also taking that mask off very carefully. Or maybe some people might decide that it's time for them to stay at home. So we will keep you updated. This is an evolving situation. We have a single case that needs to be investigated and explored. We will, I encourage you greatly to use the principles. Also, please use a check-in app, preferably the Territory check-in app, and don't just use it for 15 minutes or more. Consider using it all of the time in every place you go, because it greatly assists with contact tracing. And most importantly also, please consider having your vaccine. I know that it's a bit of a challenge because of the changing criteria, but please consider that. I know that in the future we'll give you more information about the different regimes, but please at least think about it now. And please, Territorians, look after one another, keep the Territory safe, and those who've come to visit us here, also you look after yourselves and stay safe.
Good afternoon, everybody. Our next steps from here are ensuring, certainly first and foremost at the mine site, that we surge some resources there to ensure that the testing regime can occur as quickly as possible. Obviously, there's a large number of people still on that site, but we're very fortunate in the sense that they've got an approved COVID management plan. That's been a very effective plan, and certainly in this circumstance, as it related to the individual, upon receiving the message from the New South Wales Health, he immediately reported to his supervisor, went into isolation, had the test, and as we now know, the result came late last night. He did travel on a charter flight from Brisbane direct to the mine, so it was a normal flight process that occurs within the mine, so it was contained within the employees of the mine. Clearly the number that have similarly transported off that site, they will be key, and we'll work with other jurisdictions, that work's already starting to commence, to make sure that they will isolate and get tested. The clear messaging that we're continuing to provide, though, of course, is within the greater community of the Northern Territory, as it applies to the whole of Australia, follow the basic principles of COVID prevention, and that will assist us greatly. Keep attuned to the media reporting. We'll try and make sure the information flow is constant for you as it relates to any further developments. We are deploying a rapid response team down to the mine site. They will go with additional PPE to ensure that the facility has sufficient coverage for the full 14-day period in the event that they are isolated and contained for the full 14 days. Again, we're fortunate with the design and the location of this mine site that we can achieve that. For all intents and purposes, we can turn it into a quarantine facility in and of itself, and we have the relevant expertise and skill sets to be able to do that. We will be making sure that everybody, as I say, is kept as informed as we reasonably can. There is no need for panic. I want to stress that. If people remain calm and considered in all of the things that they do, you do not need to surge on shopping centres and purchase all sorts of commodities and products. That's what actually does jeopardise our supply chain. There is sufficient food and supply always being facilitated to enter the Northern Territory, so there is no need for panic. Just follow the guidelines that we have in place. Be assured that our contact tracing will be able to identify anybody who's been exposed, and we will hopefully go through that process of eliminating them from a positive case. In the event that they have a positive case, the process will be they'll be transported either to our Todd facility in the short term, but anyone who is positive will ultimately end up in our red zone in the Centre for National Resilience in Darwin. So be aware, be calm, be cautious, follow the principles of effective COVID prevention, and help us to continue to help you. Thank you.
Can you give us a bit more detail in terms of how it's thought he contracted it in Brisbane in the hotel quarantine?
So I don't know how he caught it in the hotel. I just know it's a result of the testing. So Dr. Heggie might be able to comment further on the strain, but essentially that's how they've identified the moment. That's the advice that we have at this stage about where he developed it. And obviously on that day, we didn't have controls in place for Queensland.
How did the New South Wales COVID testing team, what's the link between the Brisbane, he's from Victoria, he was in Brisbane, and New South Wales Health contacted him? Yeah,
I can understand that. I asked questions about that myself. So it's because he had a New South Wales driver's licence. So he was contacted through the New South Wales Health team against his licence. So if he had a Victorian licence, the Victorian Health team that would contacted him was because of the nature of his ID.
But he's been in Victoria?
He travelled from Bendigo in regional Victoria on the 17th of June to the Territory via Brisbane. In Brisbane, he was obviously subject to Queensland health controls, which, as I understand it, on that day meant Victorians had to go into quarantine. So he quarantined for that day at the quarantine hotel, as opposed to the accommodation that he had booked. We believe on the result of testing at this stage, that's the day he caught coronavirus. He then travelled to the Territory. We obviously did not have controls on that day for regional Victorians or for people from Queensland. This is an important set of dates because we believe, as a result of when we think he caught it, that he was infectious over the 18th of June to the 24th of June. When he received the message from New South Wales Health based on his ID, he immediately went into isolation and got tested on the mine site. As soon as that test came back positive, through the Centre for Disease Control, we then put everything in place that we would, we've been preparing for this for a while, we then put everything in place that we had in place.
So he was in quarantine for 2 weeks, or when did he?
No, so he was
quarantine.
17th of June, travels out of Bendigo, Victoria, into Brisbane to come to the Territory on the 18th of June. So this is all over a 24-hour period. The Queensland health directions were, if you're from regional Victoria, as in from Victoria full stop, you needed to go into quarantine in Queensland. Because he's then on travelling to the Territory, he was allowed to leave Queensland. Our health directions on that day did not apply to anyone from Queensland, and they did not apply to anyone from regional Victoria. This is the benefit of tier one sites or exposure sites, etc. As they become known, you then do testing and isolation. New South Wales advised him, because of his ID, that that hotel was considered an exposure site, and as a result, he went to isolation and got tested in the territory. So we asked many questions about that same order of events this morning as well. Yeah.
You mentioned 70 close contacts, I think
Yes.
it was. How many of those left the mine site?
So my advice is those 70 close contacts are on the mine site and are being moved to Howard Springs for isolation and testing. So those 70 are part of the 754 currently on the mine site. All 754 are in isolation and being tested. We've chosen to move the 70 close contacts to Howard Springs now.
So was there anyone who was a close contact who had left before we realised he was infectious?
So there are 900. At this stage, they're not being classified that way. As we continue to work through our contact tracing, people may change classification, but at this stage, the close contacts are considered the 70, and they're from the mine site. They've been moved to Howard Springs. We're obviously working through the 900 now. We believe we do have all their home addresses, and we believe very confidently they are at their home addresses, but we're now working through that today as well. We're asking everyone to tell us exactly where they're isolating. That allows us to do our compliance checking. That allows us to make sure they're in a suitable location. That allows us to be able to advise other jurisdictions if they're isolating in those jurisdictions and for their health controls to come into place. And then as we work through that information today, we can make more decisions about what's needed to be done.
So is that 900 considered, I suppose, like casual contacts, and are they spread across the Northern Territory, or are they primarily in Central Australia?
While we have everyone's home addresses, I don't have it in a format where I can tell you right now how many of those 900 are Territorians versus interstaters. So we're working through that information. There'll be information I might have later this afternoon in that format. But we know where they are. We're working directly with all of them.
Sorry, 900 total, 700 of those 900 are at the mine, not 900 plus 700?
No, 1654. There are 754 in isolation on the mine site.
Yep.
There have been approximately 9 flights out of the mine site over those days that we consider it to be an infectious period. Each of those planes has about approximately 100 people on them. So it's approximately 900 people have left the mine site. They are all received instructions to isolate and test. We have all their home addresses, but I think as people can appreciate the format in which it's come to us, while we have all the information, we're using all that information, it's just not in a spreadsheet we can automatically sum up who's in the territory and who's interstate, but we have all the information. We're working through all that information. It's being compiled. We'll come back into a sensitive conversation later today, which is important because that will be how we can assess what tests we need to do with our testing capacity and whether we may or may not need to stand up additional testing capacity or not. So we're working through all that information now. We believe it's really important to provide clear, early information to Territorians. I'm aware of the dangers of misinformation or essentially, so let's provide early information about exactly what we do know, exactly what we are doing. As we know more information, we'll be able to tell you more as well. So that's what we know right now. Is there anything there, Territory Controller, Dr. Heggie, that I need to add to that? That's all good. Okay.
We didn't have any restrictions in place at the time he came in, but we do offer exemptions to mine workers. Is this going to make you reconsider those exemptions?
That's all based off individual COVID mine plans. The COVID mine plan is one reason why we have confidence at the moment about how we are working. So we always work through that. If they have a COVID mine plan, then that also goes to how they are cohorting their passengers, how they've organised charters, what those workers are doing in different jurisdictions. It's all very individual. So that wouldn't have impacted this decision either, if that makes sense. So regional Victoria was considered safe. Queensland was considered safe on that day. So that wouldn't have impacted a COVID mine plan, if that was the case anyway.
Given, while we don't know the strain, but treating it as the Delta strain, which is obviously so virulent that we've seen just fleeting contact has led to infection, how concerning is it that we could see it now progress into community transmission, and what sort of would be the potential next steps coming up? You've said in the past that if we have one case, we'll lock down straight away.
That's right. I want to be careful of hypothesising, but obviously I want people to know that we are prepared. So at the moment, all our restrictions are based around what we know, which is the 754 and the 900. And we believe those restrictions right now, for all the information we have, is the restrictions we need. So the isolation, the testing, so the testing and the tracing and the trapping is what we believe we need to do right now. If information changes, then I've always indicated that we're prepared to, make swift decisions. This is an exponential problem. the earlier you act, the safer you are. So if any information changes, then we will obviously, our decisions will change too. I'm just very mindful of if I say things now too early, of sending a wrong message. At the moment, we've placed the restrictions where we believe we need those restrictions to be placed, which is on the 754 and on the 900. If anything needs to change though, take it from myself, the Chief Health Officer and the Territory Controller. We've obviously discussed this situation a lot and even done scenario testing. We will make swift, sharp decisions knowing that is the best way to stay ahead of the virus.
We're obviously very concerned about keeping the virus out of remote communities in the Northern Territory. Is there a heightened risk now in those communities near this mine, large mine, for example?
This mine site's quite isolated and it's some distance from both of those remote communities. So absolutely confident right now. But I might also pass on to the Territory Controller, who is extremely familiar with that part of the Northern Territory, just to reassure Territorians. That's a very important point.
The proximity to Yuendamu and Large Manu is obviously the two more primary communities for proximity to the mine. The important message that we've got, and this has already been communicated to our people on the ground there, but also through any employee lists that are held by the mining entity, that anyone who has associations with that location or have sought to travel there, arrangements are being made to get in contact with them if they're heading in that direction, and to ensure that they isolate and undertake the testing regime. So as best we know at this point in time, obviously those areas are not necessarily in mobile phone reception areas and the like, so we do need to work through to understand if there is anybody. My understanding, if there are any at all, it would be a very low number, certainly in single figures if that was to be the case. But as I say, the relevant teams have been put on notice. We have established an incident management team in Alice Springs to assist in the coordination of activity with the mine and the personnel that may have been in Alice Springs through that region as well.
How many extra police are you sending down to the mine site?
They're just going through that planning regime at the moment as part of our rapid response. I anticipate we'll send at least several, which will assist more so in the compliance and just planning and logistics side once we're on site. The primary response element of the rapid response team is the care of primacy of health, I should say. We're there to ensure that infection control is something we establish post-haste to try and minimise any further transfer, and then also facilitate the testing regime. So from an enforcement perspective, I'm not seeing a lot of need for that. Certainly the information we have at the moment is that those at the site are being compliant and understanding of the seriousness of the issue and the potential threat to their own health.
Dr. Heady, can I ask, what are our testing rates at the moment, and what would you like to see it increase to?
Our testing rates per population actually have been really quite high. But at the moment we have a lot of people who've come here from other places and they may not recognise a couple of things. One, the way we've approached the pandemic and that we've only had one local case, no community transmission. So there is a website and there is a phone number that you can arrange for a test if you have symptoms, and I've got to say that even a headache, even some diarrhoea, and certainly anything to do with your throat or your nose might be considered symptoms of the virus. So the testing rates, we can, both in terms of taking the swabs, and we can stand up, which we did recently with the outbreak in Melbourne, stand up testing quite quickly in testing centres, both in Alice Springs particularly and Darwin. I want, though, people to be patient, though, that if they can't get an appointment to have a test on the day, please be patient, stay where you are, because there will be a number of people who might step forward. To cover off on what was said before about variants, I think we have to take a precautionary approach, and for those who understand that terminology, you look at the worst case scenario. And although the outbreak in that quarantine hotel, I think previously had been an alpha strain, so less infective, transmissible, but if it happens to be the Delta variant, and for those who don't understand the new terminology, this is one that is extremely infectious, of the order of double the infectivity of the original virus. So that's not to be ill-considered when people are mixing and moving around amongst one another. And this is a challenge because the territory, for those who've lived here and those who are visiting here, we've had a lot of freedom. And as the Chief Minister indicated, though, we've had plans, we've done simulations of the what if, and there would need to be indeed some extra controls and quite quick controls put in place if we started seeing some cases or evidence of the virus here. But I think the important thing is that we let you know about that as soon as that information is available. And again, if we went back to a time when people didn't even know what a virus or a bacteria was, they learned that the principles of staying away from other people that you don't know or you don't live with, your hygiene measures, be it your sneeze, cough or hand hygiene particularly, that and the isolation obviously and testing are parts of that too. They were understood even before people knew what these pandemics were about. So I just recommend to people you really consider the degree of your mixing at the moment when there's a lot of people around and people that you might stand in a queue, you not be able to physical distance from them. That might be a time that you actually think about carrying a mask and putting it on.
And how with that, given that he received a text message about being contact and then getting tested, he's asymptomatic? He didn't have any symptoms?
Yes, I think that's a very good question. Of course, with close contacts, we also do, and close contacts in this case, which are the ones who work very closely in proximity to the infected person, that we do test people without any symptoms, and this person was without symptoms. There are instances where actually if we see that there is evidence of some transmission here, even if it's a linked transmission, then testing people, offering tests to people who are not symptomatic at all is quite appropriate.
How many of the 1,600 workers have been vaccinated?
I'm not aware of the number because the mining company, I don't know, they and their contractors have had a policy about this. Certainly nationally there's a vaccine program and a number of these people do come from other places. I mean, we have a slightly different vaccine regime here, so I can't comment on it, but it's something really to consider for the future.
Thank you. Thank you, Ron.